Good morning, Dr. Lambrou here. Again, let's get into some x-rays, specifically some pre and post x-rays of a patient's success here at our office at Northeast Spine and Sports Medicine. What I want to show you here on the left is the first x-ray this patient had 8 weeks before the second x-ray. If we look at this x-ray from where you are at home, I hope you can see a blue line traversing up through the middle of the x-ray, which shows us scientifically where normal is for this patient's spine to be positioned, okay? Also, you should be able to see a red line. Now that red line told us at the time when we shot this x-ray, based on analysis, where this patient's spine was. This patient had significant lower back pain. Now, just for those of you at home who don't have the framework, this is the patient's right side, this is the patient's left side. We're looking at her head on, okay? And this is her entire spine. So from the low back all the way up to the neck and skull, please follow that red line and see how far to the right of normal her skull is shifted. This shift I see here is 36.8 millimeters. That's about 1.5 inches. So mind you, her skull and neck is shifted to her right 1.5 inches from normal, or from the center line. After 8 weeks of chiropractic care, specific upper cervical chiropractic management by one of our doctors here, Dr. Benjamin Linkle, we brought her to her 8-week post, or her 8-week follow-up x-ray, and look at the significant change that this individual made. Now, in this particular x-ray, the yellow line shows the normal, but the red still outlines where the patient is. If you can follow that red line up, those of you at home might have to zoom in. When we get to the top of this x-ray, looking at where her skull and neck is, she moved from a 36.8 millimeter displacement of skull to an 8 millimeter displacement. So she went from about 1.5 inches to 3/4 inch in movement. Now, something for you to chew on at home. This individual is 90 years old. Her name is Eleanor. She's a very sweet individual. She's still with us. She's on what we call supportive care, and she's still a patient in this office to maintain these beautiful changes. Now, the reason I want to show you this is not simply because someone can change their posture, but because this was a case where an individual had lower back pain, and the treatment was specific to her neck, to her upper cervical spine, to mitigate her lower back pain syndrome. Lastly, one thing you really have to take home here is how detrimental lower back pain could be. In 2013, the JAMA, or the Journal of the American Medical Association, published a 20-year study and found that the highest incidence of any diseases where an individual suffer years with disability is lower back pain. Second to that is depression. Two terrible calamities, of course, one of which we specialize here, one of which we don't, but both of which can alter your life and change your life, and in some instances lead to a very, very unfortunate form of disability. I hope you learned something today. Please take care of your posture. See you soon.